Welcome to Vital Signs of a Dog, a first aid video. If you would like to be kept up to date with related videos, please click the subscribe button and also the bell button so that we can notify you of new videos. Grab yourself a cup of coffee and pen and paper. Here we go. When you know your dog isn't feeling well, but you're not sure if they are seriously sick or not, it's a good idea to learn how to check your dog's pulse, respiration, and temperature, to help you assess them and decide on a proper course of action. Knowing what is normal for your dog will allow you to determine when something isn't quite right and get them the professional medical help they may need. The basic vital signs to check on your dog are as follows: the pulse, respiration, temperature, and capillary refill time. Don't worry, I'll explain them in detail, and how you can measure each one.
Firstly, let's look at the dog's temperature. There are two ways to check a dog's temperature. Unfortunately, the dog is unlikely to like either one. Particularly the first. It's a good idea to get a friend to hold the dog during these procedures. Keep the dog calm and reassured. Rectal temperatures are more accurate than ear temperatures. This means putting a thermometer inside their bum. So, hold the dog, make sure they are comfortable and ensure its back legs are supported. Use a proper rectal thermometer and lubricate the flexible tip with petroleum jelly such as Vaseline or KY jelly. Gently insert the thermometer into their rectum, just past the tip of the thermometer and no further, otherwise you risk injury to the dog and yourself when they bite. Hold the rectal thermometer steady for a few seconds, then gently remove it to view the reading. If you would prefer to take a reading from the dog's ear, instead of its rear, use a digital ear thermometer for dog's ear temperature readings. Ask a vet for their recommendation. You do not need lubrication for ears. Hold the thermometer at a 90-degree angle and be extremely careful not to damage the dog's eardrum. When the thermometer beeps, gently remove it and check to see if it is between 38.1 centigrade and 39.2 degrees centigrade. 100.58 Fahrenheit and 102.56 Fahrenheit. A higher temperature, especially when other symptoms are present, such as weakness, rapid heartbeat and panting, can be indicative of illness.
Let's look at taking a dog's pulse. Although heart rate and blood pressure are linked, they are totally separate issues. With blood pressure, it is the force of the blood flowing through the blood vessels, whereas the heart rate is the number of times the heart beats per minute. The dog's heart rate or pulse can be found by feeling the area where the dog's elbow meets the chest or by feeling for a femoral pulse. This is in their groin, right inside where the inner thigh meets the dog's tummy. You then count the number of beats for 15 seconds and then multiply that number by 4. Another way to check a dog's heart rate is with a stethoscope, but you can leave that kit to the vet. You can also check the heart rate, without a stethoscope, by placing your hands gently on your dog's rib cage to feel their pulse. This will provide a general idea as to whether their heart rate is too fast, too slow, or as in Goldilocks, just right. A stethoscope helps the vet notice any heartbeat abnormalities. These could be due to a heart murmur, which is an indicator of heart problems. If you feel a pulse and query any heart issues, contact your vet immediately. The average heart rate is about 80 to 130 beats per minute for small dogs, and about 60 to 100 beats per minute for large dogs. This will vary based on level activity, age, and fitness. Believe it or not, a dog can get a fever. Globally, we use the word fever to describe an elevated body temperature. This is generally by infection or some kind of inflammation. People ask, what is considered a dog fever? If a dog has a temperature of more than 103 Fahrenheit, this is considered a dog fever. Be mindful though, that 103 Fahrenheit could be the result of a dog being very excited or even stressed. There is another type of high temperature. As mentioned earlier, fever is due to illness or inflammation, but if a dog has a high temperature that is a result of hot external temperatures, like a hot summer or a hot room, as well excessive exercise in humid conditions. This condition is called hypothermia or heat stroke. When temperatures reach 106 Fahrenheit, they are very serious, and fatal complications may happen. Dog fever symptoms: there are no absolute signs of fever without taking a temperature, but some visual symptoms could include coughing, depressed mood, lethargy, loss of appetite, nasal discharge, shivering, vomiting. Also mentioned earlier, there is only one accurate way to see if a dog does have a high body temperature, and that is to take a rectal temperature. Options are a digital thermometer specifically designed for rectal use in dogs, or a mercury thermometer like the traditional glass ones. Be mindful that most thermometers intended for use in human ears are not accurate for dogs and certainly not suitable for rectal use.
Let's now look at the respiratory rate of dogs. Ensure the dog is in a resting state, either asleep or awake but relaxed, certainly not playing or running around. It is a good idea to use the stopwatch in your mobile phone, or a watch or clock with a second hand. Look to see if the dog's sides of its chest rise and fall at a regular rhythm. If you stand a foot or two away from the dog, about 30 to 60 centimeters away, you will be able to see both sides of their chest. Time the dog's breathing, to see if it matches up with the average vital signs mentioned here, and to ensure that their breathing is not labored. A dog's respiratory rate is an average of 20 to 30 breaths per minute. You could hold your hands gently on their chest to feel the rhythm of their breathing if you find it easier. The two leading causes of breathing difficulties in dogs are asthma and congestive heart failure. Let's now look at common respiratory problems in dogs. There are quite a few different conditions that affect the lungs of dogs. These include canine distemper virus. Distemper is still present in the UK. It is potentially deadly because it affects not only the respiratory system but also the nervous and gastrointestinal systems in dogs. Vaccinations are available. Chronic obstructive pulmonary disease, COPD. This is inflammation in the pulmonary or respiratory system. It progresses slowly, so it is found in older dogs. It can also be called chronic bronchitis. COPD cannot be cured, but there are treatments available that can help manage the disease. Colds and flu. Dogs can get colds and flu, just like humans, but their versions can lead to much more serious illnesses if not treated. Dogs with severe symptoms may need care such as fluids, antibiotics, and supplemental feedings. Kennel cough. Kennel cough is highly contagious. It can be caused by either bacteria or a virus. It is called kennel cough because of the way it rapidly spreads through dogs when in close contact with one another, not just in boarding facilities. Antibiotics are available. Lung tumors, caused by tumors from other parts of the body such as the abdominal organ, bones, or skin. Many tumors are malignant, but for more serious problems, surgery may be an option. Unless the tumor has spread, then surgery it may not be effective. Pneumonia. Inflammation of the lungs could be from a wide range of causes including allergens, lungworms, bacteria, viruses, and aspirated food, fluids, or foreign bodies. Antibiotics are available to treat pneumonia as well as fluid therapy and chest percussion at the vets. The most common signs of respiratory problems include blue gums, coughing, difficulty breathing, exercise intolerance, fainting, gagging after coughing, nasal congestion, wheezing. Depending on the condition, other symptoms may also be present in the dog such as lethargy, fever, lack of appetite, and other symptoms that may be noticeable to dog owners.
Now to focus on capillary refill time, CRT, in dogs. You can assess the blood flow of your dog by pressing the dog's gum with your index finger for a second or two, and then releasing it. In doing this, you are checking your dog's CRT or capillary refill time. There are many small blood vessels called capillaries in an animal's gums. When an area of the gum is pressed, blood is forced out of these capillaries. When the pressure is released, the blood should almost immediately refill those capillaries. The normal time it takes for the capillaries to refill in the dog is 1.5 seconds. A prolonged capillary refill time, CRT, occurs when the blood is not flowing adequately. This can occur if the dog is in, or is going into, shock. It can also occur in certain heart diseases. Taking the CRT is a fast and easy measurement which may indicate the dog has a serious condition.
Finally, let's have a quick look at blood pressure in dogs. You may have seen blood pressure monitors, some traditional stethoscope with a blood pressure cuff, or even electronic gadgets. It isn't suggested that you research and invest in a blood pressure monitoring equipment, because your vet can do the job and knows what to listen for. They may use a Doppler probe to listen to a dog's heart. A dog's blood pressure should be checked by a vet on a regular basis, particularly if the dog is over the age of 7 or 8, is taking prescription medication for heart issues, or have known heart issues. Hypertension, high blood pressure, is common in older dogs and can affect other parts of their body, including their brain and nervous system, eyes and kidneys. Early recognition of hypertension can slow it down, allowing you to address any underlying illnesses. If you want to take the dog's blood pressure using a blood pressure monitor, seek your vet's advice for a suitable model. You need one with a cuff that has a width of 40% to 50% of limb circumference relating to the leg that you intend to attach it, and then round up to the next sized cuff if in between. The correct size of the inflatable part of the cuff bladder would be enough to encircle 50% to 80% of the limb. It must not be placed too loose nor too tight. Being too tight will impair or block blood flow and give a false reading. A cuff that is too loose will also give a false reading or even come apart at the Velcro as it is inflated. The best site for cuff placement on a dog is on the front leg below the knee. Where this is not possible, the cuff should be wrapped around the hind leg just below the knee. With dogs that weigh less than 5 pounds, it is best to place the cuff above the elbow, which would be just below their armpit. A dog's blood pressure should be between 120 and 130. If using an electronic blood pressure monitor, we only take the top number reading and not the one below.
Well, we've come to the end of this video on the vital signs of a dog. If you would like to receive more videos like this, please subscribe by clicking the subscribe button below. There's also a bell, click that to be notified of new videos. Thank you for watching.